good afternoon, everyone. We come to the last video presentation of this vast oculoplasty session. I'm going to take you through a few videos on botulinum toxin injection and fillers for cosmetic purpose. We've already looked at the functional indications in the IC. There is a SSTC program going on about Botox and fillers, so this will just be an adjunct to that. In the meantime, any questions for the previous speakers? I think Dr. E. Ravindra Mohan is here. Before the effect of the drug, and that is a week after. So you don't want to completely paralyze the muscle, but you want to weaken the frown line so that the expression is not as aggressive. Here is a young man, middle-aged man with horizontal forehead line. So here what we are doing is 3 to 4 spots where we inject superiorly and then another row below that. So here your goal is not to treat the line but to treat the muscle below it. So obviously you would see that the wheels that are being raised are slightly deeper and they are not coinciding with the wrinkle. So there's one row just below the hairline, and you can add another row below that depending upon what is the extent of the muscle function. So these indications are again relative, and for someone who is really bothered by those lines, you would want to treat that. An extension of this treatment is occasionally when there is an asymmetry of the brow, you could inject just that side of the frontalis and bring it down to make it look better. So these were total 8 spots. You can modify that based on what is the requirement. It can even come down a little if you are also blocking the frown lines along with it. So here is a 1 week post-injection, and we'll have a short comparative clip which will tell you the amount of difference that it makes in the lines. So you can see that the elevation function is not really paralyzed, but you make it better regardless. So here is an eyeball which really shuts close when you smile, and that is a problem in some patients where the orbicularis roll is a little more thicker than a normal person. So there we just give one single spot of Botox in the pretarsal or preseptal area in the mid-pupillary line. And that itself is enough to widen the eye despite the smile extent remaining the same. We can also adjust the position of the brow based on the injection sites for Botox. So in central area, if you bring the frontalis muscle, relax it and bring the head down, and laterally if you block the lifts up, you can actually change the shape of the brow without doing any surgery. So these are achieved by just blocking the orbicularis or combining it with the central frontalis muscle relaxation. So that's a very mild kind of elevation. These do not produce drastic results like able to see here you can see the flat brow is changed its shape. Crow's feet is a very popular indication for Botox. It's just to get rid of these lines here, and you may have to feather the effect into the lower eyelid, otherwise the lower eyelid lines will look quite obvious and unusual. Talking quickly about fillers, the most common indication that an oculoplastic surgeon would do is tear trough, and that is basically to treat the hollow, under eye hollow with a filler. Filler is nothing but a cross-linked gel, much similar to the viscoelastic used in cataract. So here the product is injected in the epiperiosteal plane to take care of these tear trough, and they vary from person to person. It could be extremely deep, or it could be a combination of fat with a tear trough, and you may have to address both. So these are all various examples of tear troughs and the pseudo darkening of the skin that is along with it, treated with a filler injection. One more case where there is a little bit of fat above it, but we chose to treat the trough and made it better. The same extension can be done for mid-facial injections, where the amount that you inject would also be larger, and it is basically to lift the mid-face up so that the mid-facial aging can be corrected. So that is given in and around the zygoma, and it's primarily for shaping the mid-face along with brow shaping. Here is actually a fat transfer rather than filler injection, but essentially the concept is to elevate the convexity of the brow. So in the middle of a blepharoplasty or along with a blepharoplasty, you would harvest autologous fat from the periumbilical region, and in small aliquots you would inject that to build the volume which has been lost with age. So this is building the brow volume with either a filler or a fat injection. You can also extend these to other indications, such as enhancing the thickness as well as the filtral definition of the lip, and in any area where you have contour changes, for example, non-surgical rhinoplasty. So this is actually to plump up the lips, and this is a very commonly done procedure. If you want to add volume, it has to be on the mucosal side. There are other indications where the mucocutaneous junction can be heightened with the definition by injecting in a thread manner along the skin and the mucocutaneous junction. So these are all examples of how to increase the vertical volume as well as the outpouting of the lip by injecting fillers on the inner side. And similarly, you could actually do non-surgical augmentation rhinoplasty by using a filler. So that would mean either on the bony cartilaginous junction, or you can even build the nasion area based on what is the requirement. Some of these cases could even be post-traumatic flattening of the nose, and patient may not be too keen about surgery, but you can still build volume by giving a filler injection. And these are all done under topical anesthesia, sometimes under local infiltration. So that's a contour that you could change just by doing no surgery. Of course, the filler lasts for a year to 2, so it has to be repeated as and when required. Thank you very much.